Good morning, everybody, and thank you very much. Special thank to Dr. Chakravarti. I guess it's been a decade since when we are in touch, and he has always been an excellent mentor and teacher for me, specifically considering my stress in critical care nephrology. So, and I'm glad to see so many young nephrologists here. So I guess the future of critical care nephrology seems pretty bright. And again, thank you for everybody since morning, excellent talks. And Professor Mehta is here, so great to see him again, sir. So we'll talk about new thing, you are already seeing it. So when we talk about critical care nephrology, it's actually a nephrologist's mind which is going and getting replicated into the machine in the form of a prescription, leading to an therapy, which I believe could be a savior, not only the patient in terms of mortality or morbidity, but also in terms of renal recovery. Okay, till now then I'll continue. So I'm honored again. We had a soft launch of new Multifiltrate Pro CRRT machine in ISN Con in December. And now we are on a hard launch, full-fledged machine is launched here with the complete portfolio for CRRT. And in this year, gradually the complete portfolio which I'll be showcasing and giving you the glimpse of those things on this machine would be coming up to India. So I guess COVID has taught us a lot, and I guess critical care nephrology in terms of extracorporeal therapies went a lot in COVID. Unfortunately, what has happened, and I believe that also gave a thought process to nephrology community that how important are extracorporeal therapies for such patients in ICU, and considering the high rate of AKI in our ICUs. I guess this continues to be a understandable unmet need in a country like India. So I'm happy to announce the launch and full launch of Multifiltrate Pro machine to India on behalf of Fresenius Medical Care India, and we have our team here. I guess Bhaskar, you could stand up. Bhaskar is our head and managing director for India, and I guess I would ask a round of applause for Bhaskar because he is a newly born managing director, recently being promoted. So, and rest of the team is here. With Multifiltrate Pro, we are continuing with the therapies which were available with Multifiltrate Classic. That means obviously the CVVH, CVVHD and CVVHDF is there. Therapeutic plasma exchange, or what we call as membrane plasma exchange, is already there. Now, the one thing what is new is the look and feel of the machine. You can see it's coming up with a new look. There is a complete touch screen monitor which has a very perfect user interface. I mean, the machine talks to you. And those people here, specifically from Singapore or London, who have used this machine, they would agree this machine is very easy to talk. You know, that the machine tells you how to go ahead. And the machine also is coming up with a very easy setup. That means initially, those users in India who have been using Multifiltrate Classic, you have to put everything into the system while this machine tells you, and it's easy to set up. So that means the setting up time of the machine is lesser. This is the first part. Second, along with CVVH, CVVHD or CVVHDF, which is routinely available. So apparently, as a nephrologist, most of the times, we don't learn how to set up the machine. I guess it's my specific request to all the young nephrologists here that you should learn that. It's not necessary every time in a country like India, you might have your technician or nurse at a wrong time, maybe at 2 in the night, which knows how to set up the machine. So the first thing is that you should learn setting up the CRRT machine, and it is earlier and easier than the setting up of dialysis machine, if you know the machine in and out. Now with this machine, obviously what was missing was the addition of other therapies. The first thing we just talk about, and one of the most talkable and the things in talk is the RCA, which is renal citrate anticoagulation. So now this machine is equipped with the renal citrate anticoagulation interface. Now there is a difference. So obviously I'm not talking as a person from Fresenius. As a clinical nephrologist, we have two systems currently in India. One is Baxter, one is now Multifiltrate Pro for RCA. So one of the things which you need to understand, and you will learn soon when you will see the demo of the machine, that please don't think that the same protocol which is used on Baxter is the same one on Fresenius. No, the both protocols and the setup are different, right? That you will learn soon. But now which is available as renal citrate anticoagulation, you can do CVVH, CVVHD and CVVHDF, all the therapies with renal citrate anticoagulation. I can see Baxter guys smiling back there. So this is the thing, and I guess I have talked a few things. So now what is being offered, that CRRT for AKI patients is obviously heparin is always available. So heparin based or Zika based CVVHD, CVVHDF and pre and post CVVH. Now the major difference which I'll just mention, and I saw that post dilution, obviously CRRT is beneficial because we achieve better clearance, not only of small but the unwanted higher molecular weight toxins. But it's not easy to do, because the filtration fraction always creates a kind of a hurdle or a speed breaker with that. And in a country like India, where CRRTs most of the time is out of the pocket, it's cash, and we cannot have the filter getting clotted early, because that is a direct impact on the cost of the therapy. So that means, and heparin, obviously, one, it's a risky thing. We don't know how to reverse or deal with heparin, and bleeding is a higher risk. So RCA is required. But with RCA in Multifiltrate Pro, you can do post dilution. So that means CVVH, CVVHD or CVVHDF with RCA will be done as post dilution, because the citrate, which is the 4% trisodium citrate, is a 1.5 liter bag, which is given pre-filter but not as a pre-dilution. It's just a citrate, and at an average dose of approximately 170 to 180 ml. So apparently it's not adding into the pre-dilution factor, and you can easily do and perform post-dilution citrate-based therapies with this technology. Second, this machine would be the first machine, I guess, if I'm not wrong, and correct me if I'm not, with the first machine which will be having a specific interface to do hemoperfusion. That means, for example, if you want to use cytosorb, currently we use cytosorb as a series. The machine does not know it, right? We need to adjust the prescription as per the filter. But now the interface, that means the version 7, would be having an interface for the hemoperfusion. That means the machine would be knowing that you are going to do hemoperfusion, right? So that not only makes the therapy better, but also easier for you to do it. Then therapeutic plasma exchange or membranous plasma exchange continues to be the same as it was there. And on addition, what COVID has told us, what regards that what we need, and ECMO. ECMO, I guess many people, specifically across the globe, not only India, many people in our fraternity, ex-nephrology or ex or out of critical care, might not be knowing ECMO. But now ECMO is like a, Deepika Padukone. Everybody knows it, right? So, but in a country like India, every patient cannot be taken on ECMO. When we talk about CRRT, cost is a huge factor. But ECMO is like elephant of that part. So we cannot have ECMO for all patients, but it's always there when it is required and can be affordable. So this machine also comes with multi-echo 2R. That means there would be a facility of attaching a filter and removal of CO2 by an extracorporeal system through this technology. So this is the whole list of all the therapies with what all you can do in a proper way, and I will capture the words from Professor Mehta. His initial things, what I always show in my lecture, is slow, continuous and gentle. So this is just a glimpse of the machine. I mean, I don't think it's better because the machine is now there, and you will soon in the demo part and the workshop with ma'am, you will see how the machine works. So I'll not have the other time wasted on this slide, but I'll have to stop on this slide. So this machine has 6+1. So 6 dedicated therapy pumps, that means blood, dialysate, substitution, filtrate, citrate and calcium, plus 1 which is heparin. So total 7 pumps are there in this machine for your dedicated prescription and therapy which is required as per the patient. And I'll again copy one word from ma'am, which she said that patient-centric. So when you are offering a prescription patient-centric, you have the pumps and you have the prescription modality available into the technology. Again, screen is adjustable, so it's not fixed. You can see there's the handle in the front and there is a handle in the back side also. So I mean the machine is easily movable. And now you will think why a nephrologist needs. As I said, I needed it many times when my technician was not knowing what to do with the machine, whether it was Prismaflex or Classic when I was in different hospitals, and moving this machine is a torture because as you move, the weighing scales are disturbed and you start getting pa. And I'll again say that I used to call at 2 in the night to the clinical experts that time to understand what is happening. So you need to know, so that means the machine is movable. You can see on the back side of the machine there are the holders which are there for the bags. So you can at one time keep 20 liters of fluid on this machine. So that, why 20 liters? Because that reduces the time spent by your technicians or nurses to change the bags, you know. Now second part is that there is a change in the fluid coming to the patient, slightly change. So there is a one line which is coming from the fluid, whether it is dialysate or replacement, and that is then divided into the respected pumps, right? So what, I don't know, it is clinically not that much relevant in very experienced ICUs, but in a country like India where still it's a budding therapy, it can have, and we have seen errors because with this we have a fluid which is multi-big which comes in 0, 2 and 4 potassium variants. I'll just show you. So we have seen errors happening when the technician or nurse at the night, they got confused and they took a different bag. Maybe the patient was needing a 2 variant and they took 4, whether there is a color coding, but it happens. So now that error is not there. You will have one fluid, whether potassium 2 or 4 or 0, and that error is reduced. Ergonomically it is good, rather it is valid mostly for those countries where there is a dialysis nursing. In our country we have most of the time dialysis technicians, most of the time they are males, so the height should not be a problem. Okay, so machine, we will have more better workshop and demo coming up. Now, so this is just slightly a glimpse of TPE, so you all know the circuit, how it works. This is the application of cytosorb or any hemoperfusion column along with CRRT. Now the point is that currently there is no consensus whether this hemoperfusion column should be given pre or post hemofilter, right? So now what I believe that with the V7 interface of hemoperfusion, when the machine knows you are putting up a hemoperfusion filter with the thing, it would be much better and easier. That is again another filter, Seraph 100. Within a couple of months, you will be having Seraph 100 in this country also as a adsorbent column for sepsis. And so I'll not go in those details. I'm just done, sir. So I'm not going into details. I told you about CVVH, CVVHD and CVVHDF, which is possible with this machine. And this is my last. So obviously fluids are very important part of a CRRT therapy. Multibic, I guess all of you know. Those who don't know, I'm just give a quick glimpse. Multibic was launched as a CRRT fluid last year. It's a 35 millimoles per liter, 100% bicarbonate based CRRT fluid with 0, 2 and 4 potassium variants. That means you can choose the fluid as per your prescription and patient requirement. And it has 24 months of shelf life, and even if by mistake the fluid is mixed, you can still use it within 48 hours. So, and the last, this is all of you know. I guess I'll go with sir because demo would be the better part. So acute solutions from Fresenius Medical Care, by this year you will have 7 fluids, different 7 kind of fluids for different kind of prescriptions on CRRT, along with many other therapies which would be available and possible on the same CRRT machine. So I guess after this we will have a workshop and we will have a demo You can all see how this machine is getting set up, how this machine works, what all is there. You can all come and do this on the machine, and I guess I would like to, as per sir said, we should spend time much more time there rather than myself telling you the things. So that's all my time. If any questions, I'm happy to answer. Thank you.